Hi, I'm Ashton. I'll be doing my straight cath validation today. I am currently outside the room. I'm gonna go over the chart quick before I head in. The patient's Mary Sanford, date of birth 11/12/98. No allergies, full code. We have a 26-year-old female who gave birth 6 hours ago, vaginally. Medications look pretty normal. Vital signs are normal. Breath sounds normal. She did have a Foley in during the labor because of her epidural. This was removed prior to pushing. She's been unable to void since then. So about 6 hours. It says she does feel some bladder pressure but is unable to void. Everything else looks pretty normal. She is in some pain because of that bladder pressure and just giving birth. Okay, our only order for right now is to insert a straight cath to empty the bladder. I'll be heading into the room. I'll do hand hygiene back here. Okay. Provide privacy. Hi, I'm Ashton. I will be giving you a straight cath today. Could I get your last name and date of birth?
Mary Sanford, 11/12/98.
Okay, I'm checking your wristband. It matches up. We're good. Okay, have you had a catheter in the past?
Yes, I believe I had an indwelling one before the epidural
Okay.
or something.
Yep, that is correct. A straight cath is very similar, but instead of leaving it in, just gonna put it in, empty your bladder, take it out. How are you currently feeling?
I'm having some pressure because I haven't been able to pee.
Okay. I'm gonna check out that location and then we'll have a CNA come in and wash you up, and then I will bring my materials back in. We'll do that straight cath, empty the bladder. Hopefully we'll put you in less pain, and that should be about all today. Do you have any questions for me?
No.
Okay, I'm gonna grab these gloves. Okay, I'm just gonna look around for a second. Is that okay?
Yeah.
Okay. Okay. You do feel a little distended. Is this about where it hurts?
Yeah.
Okay. Look here. Okay. I will actually just leave this up so the CNA can wash you up. They can come wash you up. I will head out, grab my stuff, and be back in a minute.
Okay.
Okay, I'm grabbing my stuff. I'm gonna take this into the room. Okay. Set that up. Okay. CNA came in and washed you up and everything?
Yep.
Okay. We're gonna, can I get your last name and date of birth again?
Sanford, 11/12/98.
Okay, I did hand hygiene, provided privacy, verified on your wristband. Is it okay if I lift your gown up again?
Yep.
Okay. I'm gonna have you lift your knees up and try to angle them outward for this, if that's okay. Okay, there's that. Does that feel okay?
Yep.
Okay. Okay, this was intact and everything. It's been opened, but we're gonna imagine it wasn't opened. I didn't touch anything on the inside. I haven't touched any of the inside. I just was able to grab the gloves, which are no longer sterile. Okay. I'm able to touch my 1-inch borders on the outside here. I'm gonna grab the outside cuff, use my dominant hand. Still grabbing the outside cuff. There's that, okay. Now we're gonna stick the hand inside, right there. Still just touching the sterile part, the inside. I can grab here because it's still sterile. There we go. I can adjust on the outside. Okay, I'm gonna put these towels down. One's gonna go underneath you a little, and then one will go over top of you, if that's okay.
Okay.
Okay. Okay, we're gonna put the shiny side down here. There we go. Careful not to touch anything. Okay. Okay, just touching the inside of this. See, these can be tricky sometimes. Okay, putting the shiny side down. I can touch this because it's sterile. Okay. Now, I have some iodine swab sticks here. Do you have any allergies to betadine or latex?
No.
Okay. Okay, I'm gonna grab these, open. While I'm doing this, I also could put my lube in here just to use for the catheter. But, okay. Keeping these clean. Okay. Is it okay if I touch you?
Mm-hmm.
Okay. Open up, we're gonna go further side from me. Drop in. There we go. Okay, closer side. Up and over, drop in. Okay. Down the middle, up and over, drop in. And I'm gonna grab the inside of this. We're not gonna go on these towels because those are sterile currently. This has lubrication currently on it because I put it in here. Okay, I'm gonna insert this. Try to stay relaxed. Don't tense up too much. I'll insert it in 3, 2, 1. Okay, I went 2 to 3 inches. For a male, it would be about 7 to 9 inches depending on the male. It is currently draining. That's good. Yep. Okay. Looking at it, color looks good. Could measure it, and here there is some strips on the side. Okay, I'm gonna remove it in 3, 2, 1. Okay, steady. Just put this in here. Okay, I am no longer sterile. I can throw this away. Throw this away. I'm gonna take these off. Throw my gloves away. I'm gonna cover you up. Everything feel okay?
Yep.
Okay. Does the bladder feel a little better?
Yes.
Okay. So now I'm gonna leave the room for a little bit. I'm gonna document all this, give you some privacy, give you some time. I'll help you relax your legs right now. And I will come back in 15 minutes and check you out. I'll just see your bladder, see if you have any pain, see if everything's feeling okay.
Okay.
Provide privacy, hand hygiene. Your area is all cleaned up now. Your call light's in reach, your bed's down, your rails are up. Okay. I'm gonna head out. Okay, knock knock. Mary?
Yep.
It's Ashton again, privacy, hand hygiene. Could I get your last name and date of birth again?
Sanford 11/12/98.
Okay, looks good. I don't have gloves anywhere. I would have put gloves on here. I'm just gonna check out the area if that's okay.
Yep.
Okay. Is your bladder still feeling better?
Yes.
Okay. Feels good. You having any pain or discomfort or anything?
No.
Okay, do you have any questions for me?
No.
Okay, have a good rest of your day. I'll head out. Privacy, hand hygiene, the area looks all clean and good.